Here at Frantz EyeCare, there's a team of experts who care about your health. And now is your chance to get to know these medical professionals with Ask the Experts. So let's catch up with Dr. Kimberly Feder as she explains ocular surface disease, which is often the result of dry eye.
A lot of patients don't realize when they start talking to you that what they're experiencing is dry eye, or ocular surface disease, as we call it, because it is a chronic progressive disease, and it does worsen if not, treated. 70% of our optics of our eye is dependent on our good tear film. So without having that good tear film, it really can affect your vision and the comfort of your eyes. I mean, technically, we really shouldn't think about our eyes day to day. It shouldn't be affecting our daily life and activities, but dry eye really does do that, and it really affects patients, and they are struggling in their daily life, and they're struggling to get comfort in their eyes. Unfortunately, no cure for dry eye, but we can really make a difference in patients' vision and in their life. We have these glands called meibomian glands that produce the oil in our tears. It keeps more tears on the surface, but what happens is over time, once you lose those glands, you lose them. And so by treating that, a lot of times that can really make a difference to patients to save the glands that they have and make their vision better. Dry eye tends to certainly be multifactorial, meaning many causes, but we try to get to the root cause of the biggest issue. And to treat that, we have procedures in the office that are FDA approved for dry eye treatment. Starting from the surface of the eye, our lashes, they tend to build up normal bacteria that's found on our skin, and we also get this biofilm that blocks the surface of these meibomian glands. So the first procedure that I would recommend for patients that have that and that's significant is something called BlephEx. I call it like an exfoliation of the eyelids. We use a foam that cleanses the lids and lashes, and we clean everything off. And the difference when I see patients first with this debris and this biofilm to when I see them afterwards is significant. I mean, talk about a clean slate. When we talk about meibomian glands and these glands in our lids and this blockage and inflammation that it causes, a big procedure we do is something called IPL. An FDA-approved procedure that uses intense pulse light, and that zaps these inflammatory blood vessels that cause the function of the glands to improve. On our third treatment of IPL, we add in something that's FDA-approved called LipiFlow. And LipiFlow is, I call it a massage for the eyelids, but we put there's an activator that goes in around the eyes, and it heats the oil glands 10 degrees more than body temperature. It actually pulsatile pushes air and massages the lids, but what it's doing at that moment is removing that thickened oil. The other thing I do for every patient after every procedure is I manually express the meibomian glands. But I actually push on the lid margins to get the glands and some of that oil out of there each time. And that is very relieving, actually. If patients feel like immediately their eyes feel better. Really what's worked so well for patients is to be able to do these in-office procedures as well as tailoring a at-home treatment regimen for patients. And dry eye is so significant that a lot of dry eye treatment has come out for patients to be able to help them at home. So the combination of getting to the root cause of their dry eye in the office, as well as the tailored treatment to their eyes at home, really makes an improvement for patients.
Frantz EyeCare, creating better vision for a better life.